Welcome to another episode of COVID-19 Conversations. And today we are going to continue to chat with Dr. Ong Hean Yee, a cardiologist from Singapore and who is also the president of the Singapore Cardiac Society. And today we are going to talk about the relationship between hypertension and COVID-19. Hypertension is so prevalent all around the world. And in this current COVID-19 pandemic, let's hear from a cardiologist on this topic of hypertension in this time of COVID-19. Hi, welcome, Dr. Ong.
Hi, Dr. Chan.
So can you share with us, what are the implications in terms of increased risk of a poorer outcome or even mortality for a person with hypertension when they contract COVID-19 versus somebody who is otherwise fully healthy, don't have any of the underlying chronic diseases?
First of all, we think that the risk of contracting COVID-19 is independent from having hypertension or not.
Yep.
Now, the question, as you correctly phrased, is that if you have hypertension and you have COVID, do you have a poorer outcome?
Yep.
The initial data from Wuhan and certainly from other places as well, there's a strong suggestion that your risk of having a poorer outcome is almost doubled. But if you have the more severe form of heart disease, let's say heart failure, for example, then that effect is much more magnified. We consider hypertension to be a continuum of heart disease. On one hand, hypertension is what we call mild heart disease. On the other hand, heart failure will be a very severe form of heart disease.
Yep.
We say that because the enzymes, the chemicals or the enzymes that are elevated in the hypertension are also the same enzymes that are elevated in the more severe form of, let's say, heart failure.
Yep.
So there is a risk definitely if you have heart failure and or hypertension.
You would say that the ballpark of a poorer outcome of a person with hypertension versus otherwise healthy person not having any of the chronic conditions, right, is about doubled.
Yeah, double, roughly.
Right, about double the chance of dying from COVID-19 or having a severe form or going to ICU. Right? I mean, the data is still coming in, like you mentioned, but increasingly, right, there is something that is being noticed, right, from all around the world. We both have also gone through SARS, right, in 2003, right, and I think the difference then and now, right, not just about the healthcare systems and advancements in medical care. I think a big difference that I noticed, I'm sure you noticed as well, between SARS 2003 and then this COVID-19, starting in 2019 and to now in 2020, is media, right? It's the explosion of social media and the information that everybody been able to access. I think during SARS, it was very different, a different world. So right now, during this COVID-19 pandemic, in the very early stages of it, something happened with regards to hypertension. In particular, right, antihypertensive drugs, a few classes of them that has a theoretical possible increased risk of being susceptible or being more susceptible to contracting COVID-19. There was something that within the medical community, rightfully, questions were being asked because the basic science of it seemed to suggest that we need to go and look into whether a person taking those drugs, right, are more susceptible, right, and whether to discontinue them or not. But I think in this current information world, that discussion on the basic science was not just limited to the medical and the scientific community. It became something that was available and many people began to know about it, right? And some even took the decision to even discontinue their antihypertensive medication. We want to say something about this episode, right, of COVID-19 and hypertension and the certain antihypertensive drugs.
The link between hypertension and coronavirus, the link is actually known for many years. With SARS 2003, we already knew that the coronavirus attacked the cells via the ACE2 receptor. And we're actually looking for evidence that these hypertension drugs or patient hypertension had a worse outcome with coronavirus infection or even the normal influenza infection or the other viruses that's running around.
They're more susceptible to contracting it.
more susceptible to contracting the severe form. Yes.
The severe form.
For influenza, for coronavirus, not only the COVID-19, but other coronaviruses. And the reason is like this. A lot of the damage to the lung or to the heart is mediated via what we call the RAAS pathway, the renin-angiotensin-converting pathway. So a lot of this damage is actually mediated through this pathway. Of course, there's the direct damage by the virus, but a lot of the ongoing damage is also mediated by this pathway. And there's always this suspicion that patients with high blood pressure, this pathway is a bit messed up, to keep it simple. And therefore, they're more likely to get lung damage and heart damage if they get infected by a virus that attacks this pathway. So there's always this thing in the background since 2003, 2005 actually. Now, with this COVID-19, I think Fauci mentioned very briefly in a JAMA is an American medical journal, a very prestigious medical journal interview, that there is a possibility that this may happen. He mentioned it very briefly in a very long interview. It was just 1 or 2 sentences, and this was picked up by the mass media. There's also another editorial in the Lancet, and this was early in March. Some scientists published really a hypothesis that this could be happening with COVID-19 as well. Really a rehash of what we already suspected after SARS version 1.0 in 2003. This was picked up by mass media, and the headlines came out that blood pressure medicine may make COVID-19 worse. The moment this came out in mass media, I was getting called by my patients, even my friends who are on blood pressure medicine, whether it's safe to...
Your friends, as in even your medical doctor friends?
Yeah, no, medical friends as well as my medical colleagues. Hey, what's this story about ACE inhibitor and ARBs, which are the 2 blood pressure medicine in question? We're getting bombarded by patients with this question. And although for my patients, I tell them, hey, please continue taking the medicine. I can't say the same for other patients who I'm not looking after. So that was in middle of March and early April actually. Okay, again, the first data came from Wuhan, China, and there was a couple of quickly published papers, some of them single center, some of them multi-center from Wuhan, Beijing, Shenzhen, that showed that there's either a neutral effect, or if you are on this class of medication, you actually had a better outcome. Better outcome, yes.
Instead of the theoretical worse outcome.
Worse outcome, yes. As Cardiac Society, obviously, we're concerned by this chain of events, and we actually published a position statement, I think on the 16th of March, the day after the European Society published their position statement to say that please continue your medication based on the early data we're having from China. This position statement, we try to spread through our internal email chain, and we try to post on social media, but the pickup rate, I think, was quite poor, and we were still getting questions from the public as well as my colleagues. And finally, we managed to publish a letter in Today Online, if I'm not wrong, sometime in April. Again, we published another letter in the Chinese newspapers as well to remind people of the official scientific consensus on this issue, to please continue your blood pressure medicine.
Yeah, I think this episode, certainly raised the point that in today's information age, all right, information is double-edged. When it comes to medical treatments, how we doctors make decisions, we don't base it on the basic science, the theory of it. We need to base it on evidence, right? On not what potentially, theoretically might happen, right? But based on what the evidence of what actually happened over a period of time for a group of people, especially if they are well-studied in well-controlled trials. Right, so this episode of this antihypertensive drugs, a question mark about it, patients even discontinuing it on their own because of what they read in the mass media, in social media. It raised the point that I think it is very important to have this relationship, these communications, right, with the physician, with the doctor taking care of you. It's fair that you have questions because it is your health. Right? But before you make any decisions, especially in discontinuing medications that you're on, have that conversation with your doctor. Get evidence-based recommendation, get evidence-based advice. Right? So I mean, I wanted to raise this up because it is an issue. Right? It is an issue that whether it is different media or different people who have influence over in terms of information around the world, and they share something, sometimes unintentionally, right? It may raise certain questions that will be poorly discussed, right? Poorly evaluated and leading to wrong decisions. right? So I think your message is that, the control of hypertension is still relevant and maybe even more important in this time of COVID-19. And if you are at this moment in time being prescribed certain medications for hypertension to control your blood pressure, before you make any decisions to make any changes, continue. And if you want to make any changes, please do that in consultation with your doctor in charge. Yeah.
Exactly.
Okay, hypertension is not just very prevalent in any population around the world, including Singapore, in Asia, in Europe, in the States. And we also know that lifestyle and dietary factors have a significant impact on blood pressure as well, or have a significant impact on the outcomes, right? The health outcome, the health journeys of people with hypertension. In this topic here, what would you, as a cardiologist, advise a person, right, with hypertension, other than, continuing to be compliant, to continue to take the antihypertensive medication, right, in consultation with a doctor, working closely with a doctor? What else can they do on their own?
The two biggest drivers of hypertension is obesity and salt intake. So salt intake is a major cause of hypertension in modern society, and we definitely eat too much salt every day. I think the reason is that salt is so cheap now. Salt, if you remember historically, because salt was so expensive, it cost about 1/3 of your monthly income in the late 19th century to buy salt for every day. But now salt, you can get your one packet of salt for less than $1.
Yep.
They'll last you for months. I can't remember when the last time I bought salt. So salt intake is the number one cause of hypertension. The second, of course, is obesity.
Yep.
For every BMI that you go up, your blood pressure will go up. So the two biggest is obesity, overweight, one, and two, salt intake.
So you will advise people with hypertension in this time of COVID-19, this might be a good opportunity to improve the overall lifestyle and dietary habits. Holistically, whether it's exercise, whether it's stress management, whether it's sleep patterns, whether it's a diet, including salt, but not limited to salt, right? Including the overall intake of fruits and vegetables and the whole of the diet. And that's one message that I always give to my patients. And during this period of COVID-19, I've also been conducting training programs for patients and for the public in the area of dietary habits change, right? To control, to prevent hypertension, high cholesterol, diabetes, so as to prevent the consequent, end-stage diseases, whether it's heart attack, stroke. My message to them had always been and will be that now, more than ever, it's a good time to start getting the house in order, getting the lifestyle, the diet, right, totally in order. And we should be very helpful in managing, right, in controlling your blood pressure, of course, alongside with whatever medications that your doctors are prescribing to you. Right? So I think that doctor-patient relationship remain very important. Nobody should be changing or discontinuing their medication without consultation, working closely with the doctor. I think that's a message that I always want to send to everybody.
That's right.
Right?
I forgot to add the exercise.
Okay.
As I said, although there's a circuit breaker on, your gyms are closed, you can still walk with a mask on. 30 minutes is perfectly doable. Yep. It's cheap. You just need a pair of shoes and half an hour.
Yep. So certainly, here's a reminder for everyone. In this time of COVID-19, the pandemic, COVID-19 is going to be around for more than just a few months more, or even longer than that. So now is a good time. Exercise, lifestyle management, sleep, stress management, diet. Because hypertension, and the implications, right, of outcome, right, if you should contract COVID-19. So thank you, Dr. Ong. Right, so thank you, Ong, for coming on to this COVID-19 conversations. Take care, everybody.
Take care and keep safe.